Minimal side effects. You'll barely notice you're taking it. These were the exact words Maria heard when her doctor prescribed amlodipine. 6 months later, she couldn't recognize herself. Swollen ankles, crushing fatigue, and gums so overgrown she stopped smiling. Maria isn't alone. Over 100 million people worldwide take this harmless medication, yet 95% of doctors remain unaware of what cutting-edge research has just revealed. Before we expose these shocking findings, if you're new here, welcome to our Health Investigation series. Hit that subscribe button and ring the notification bell because we're uncovering medical truths that could save your life. Drop a comment telling us which medications you're currently taking. Your experiences might help others. Let's protect each other's health together. Here's what will astound you. A groundbreaking 2025 pharmacovigilance study analyzing tens of thousands of adverse event reports has shattered everything we thought we knew about amlodipine safety. Women face triple the risk of certain complications. Genetic markers can now predict who will suffer permanent changes. Some side effects persist long after stopping the drug. These aren't rare occurrences. They're documented patterns from prestigious medical journals involving massive patient populations. Yet somehow, they remain invisible to prescribing physicians. Today, we're exposing 12 meticulously researched side effects that challenge the very foundation of modern blood pressure treatment. The evidence comes from leading universities and medical centers worldwide. Ready to discover what lies beneath medicine's most prescribed blood pressure medication? All right, here comes the list of amlodipine side effects, kicking off with number 1, peripheral edema. Your ankles have tripled in size, your shoes don't fit, and walking feels like carrying concrete blocks attached to your legs. This isn't simple water retention. This is peripheral edema, and the statistics from clinical trials will shock you to your core. Research published in multiple peer-reviewed studies reveals that at 10 milligrams daily, peripheral edema strikes 10.8% of patients compared to just 0.6% taking placebo. A meta-analysis examining thousands of patients found that 16.6% develop edema on amlodipine versus 6.2% on placebo, nearly a threefold increase in risk. Women experience this devastating complication at rates 2 to 3 times higher than men. The mechanism is complex. Amlodipine causes massive arterial dilation while leaving venous capacity unchanged, creating a pressure imbalance that forces fluid from your bloodstream into surrounding tissues. Your legs become reservoirs for trapped fluid, and standard water pills often provide no relief because this isn't ordinary water retention, it's mechanical entrapment caused by vascular dysfunction. Clinical trials comparing different formulations found that up to 46.5% of patients on standard amlodipine developed peripheral edema. A randomized controlled trial comparing conventional amlodipine with S-amlodipine showed that even the improved formulation still produced edema in 31.4% of patients. Environmental factors play a crucial role, with warm climates exacerbating the problem through additional vasodilation. Some patients report persistent swelling that lingers for weeks after stopping the medication, suggesting potential lasting damage to their circulatory system. Research indicates that edema often affects quality of life so significantly that it becomes the primary reason for medication discontinuation. Next, side effect number 2. Drug-induced liver injury. While you're focused on your blood pressure numbers, amlodipine may be quietly damaging your liver. Case reports published in medical journals document patients whose liver enzymes skyrocketed to dangerous levels within days of starting this supposedly safe medication. One documented case from Curious involved an 88-year-old woman whose liver enzymes shot up to levels 40 times higher than normal just 2 weeks after beginning amlodipine therapy. Another case report published in Sage Open Medicine described a 47-year-old man whose liver function deteriorated so rapidly that doctors initially suspected acute hepatitis. The pattern emerging from research suggests amlodipine can cause idiosyncratic drug-induced liver injury with a mixed hepatocellular cholestatic pattern. This means the medication can simultaneously damage liver cells
and block bile flow, creating complex liver dysfunction. What makes this particularly insidious is that liver damage often progresses silently. Early signs may include vague fatigue, mild abdominal discomfort, or subtle changes in digestion, but by the time jaundice appears, significant hepatic injury may have already occurred. Studies show that amlodipine-induced liver injury can take 4 to 8 weeks to fully resolve after medication discontinuation. The Liver Tox database specifically lists amlodipine as being linked to rare instances of clinically apparent acute liver injury. Recent pharmacovigilance data have flagged liver-related complications as emerging safety signals.
Next, side effect number 3, palpitations. Your heart should maintain a steady, reliable rhythm, but amlodipine can transform it into an unpredictable storm. Clinical trial data reveals that palpitations affect 4.5% of patients at maximum doses, with women experiencing this terrifying side effect more than twice as often as men. These aren't minor heart flutters that resolve quickly. Patients describe episodes where their heart pounds violently, races without apparent cause, or skips beats in patterns that leave them breathless and panicked. The mechanism involves amlodipine's powerful vasodilatory effects, triggering compensatory increases in heart rate as the cardiovascular system struggles to maintain adequate circulation. Research has documented cases where patients develop persistent arrhythmias requiring emergency medical intervention. Some individuals experience episodes lasting hours, triggered by simple activities like standing up or climbing stairs. Most concerning are reports suggesting that certain cardiac rhythm disturbances may persist even after discontinuing the medication. The combination of unpredictable timing and potentially serious nature of these cardiac effects makes this one of the most anxiety-provoking complications patients can experience while taking amlodipine. Next, side effect number 4, gingival hyperplasia. Imagine discovering that your gums have grown so extensively they're covering your teeth, making eating and speaking difficult. This nightmare scenario is gingival hyperplasia, a documented complication that can permanently alter your appearance and oral function. Medical literature contains case reports of patients developing massive gum overgrowth within just 2 months of starting amlodipine. The mechanism involves the drug's interaction with gingival fibroblasts through inflammatory mediators including interleukin-1A, interleukin-1B, interleukin-5, and interleukin-7, causing uncontrolled tissue proliferation. Research shows this condition affects approximately 1.7% of amlodipine users, with higher incidence at 10 mg doses. A systematic review comparing calcium channel blockers found nifedipine has the highest incidence at 6.3%, followed by diltiazem at 2.2% and amlodipine at 1.7%. The overgrown tissue becomes firm and fibrous, often requiring surgical removal even after medication discontinuation. Studies indicate that complete resolution can take 1 to 8 weeks after stopping amlodipine, but some patients require gingivectomy procedures to restore normal gum contours. Poor oral hygiene appears to be an important risk factor. Recent molecular research has identified specific genetic polymorphisms that may predict individual susceptibility to this complication. The psychological impact includes embarrassment about appearance, social avoidance, and significant impacts on quality of life and self-esteem.
Next, side effect number 5, dizziness and neurological effects. Your brain becomes a battlefield when amlodipine disrupts normal neurological function. Clinical trials document dizziness in 3.4% of patients at maximum doses, but this statistic fails to capture the full scope of neurological complications being reported. Beyond simple dizziness, research has identified cases of peripheral neuropathy where patients develop numbness, tingling, and burning sensations in their extremities. Some individuals report cognitive difficulties, memory problems, and a general sense that their thinking has become clouded since starting the medication. Most disturbing are reports of severe headaches that differ completely from patients' usual headache patterns. While some studies show reduced headache frequency at lower doses, others develop new, excruciating headache patterns that may not respond to conventional pain medications. The mechanism likely involves amlodipine's effects on cerebral blood vessels and potential alterations in neurotransmitter function. Recent research suggests these neurological effects may be more common than clinical trials initially indicated, particularly in elderly patients who may be more susceptible to central nervous system complications. Next, side effect number 6, nausea and abdominal pain. Amlodipine can transform your digestive system into a source of constant misery. Clinical data shows nausea affects approximately 2.9% of patients, but this doesn't capture the full spectrum of gastrointestinal complications being documented in real-world use. Patients report severe abdominal pain that can mimic serious conditions, persistent nausea that makes eating nearly impossible, and constipation that becomes so severe it requires medical intervention. The mechanism involves calcium channel blockade in digestive tract smooth muscle, leading to altered motility and delayed gastric emptying. Research suggests amlodipine may affect gut microbiome composition, potentially causing lasting changes to digestive health even after medication discontinuation. Some patients develop symptoms resembling gastroparesis, where food remains in the stomach for abnormally long periods. Emergency department visits for unexplained abdominal pain have been documented in amlodipine users, with symptoms resolving only after medication discontinuation, highlighting the challenge of recognizing this drug-related complication in clinical practice.
Next, side effect number 7, flushing. Your face becomes a furnace without warning, turning bright red and radiating intense heat that can last for hours. Clinical trials show flushing affects 2.6% of patients at maximum doses, but women experience this humiliating complication 3 times more frequently than men. The episodes involve massive dilation of facial blood vessels, creating intense burning sensations accompanied by visible redness that can extend to the neck and chest. These attacks strike unpredictably during important meetings, social gatherings, or intimate moments, causing significant embarrassment and social anxiety. Research indicates that environmental factors, including warm weather, spicy foods, alcohol, and emotional stress, can trigger severe flushing episodes. Some patients develop such intense reactions that they begin avoiding social situations entirely, leading to isolation and depression. Most concerning are reports of persistent facial redness that doesn't resolve between episodes, suggesting potential permanent changes to facial blood vessels that can significantly impact appearance and self-confidence. Next, side effect number 8, fatigue and drowsiness. Amlodipine can drain your vitality, leaving you struggling to accomplish basic daily tasks. Clinical trials document fatigue in 4.5% of patients, but the real-world impact appears far more devastating than these numbers suggest. This isn't ordinary tiredness that improves with rest. Patients describe overwhelming exhaustion that makes concentration nearly impossible, brain fog that clouds thinking, and persistent weakness that interferes with work, relationships, and previously enjoyed activities. The mechanism may involve effects on cellular energy production and potential interference with normal sleep architecture. Research suggests amlodipine can disrupt deep sleep phases, preventing restorative rest even when patients spend adequate time in bed. What's particularly troubling is that this fatigue often worsens over time rather than improving as the body adjusts to the medication, creating a progressive decline in functional capacity that can devastate quality of life. Next, side effect number 9, muscle cramps and stiffness. Sudden, severe muscle cramps can strike without warning, leaving patients writhing in pain and unable to move normally. While less commonly reported than other complications, muscle-related side effects can be absolutely debilitating for those who experience them. The mechanism involves disruption of calcium channels and muscle tissue, interfering with normal contraction and relaxation patterns. This leads to abnormal muscle tension, painful spasms, and generalized stiffness that can significantly impact mobility and physical function. Research indicates these symptoms often worsen with physical activity, exercise, or cold exposure. Some patients find that activities they previously enjoyed become impossible due to painful cramping and persistent muscle stiffness. Case reports have documented severe muscle pain requiring prescription pain medications for management, with some patients initially evaluated for serious neuromuscular disorders before the connection to amlodipine was recognized. Next, side effect number 10, depression and mood changes. Hidden within adverse event databases are reports suggesting amlodipine may be silently undermining your mental health. Recent pharmacovigilance analyses have identified depression, insomnia, and personality changes as potential safety signals associated with this medication. Patients report sudden onset of depressive symptoms, anxiety episodes that seem to emerge from nowhere, and sleep disturbances that leave them feeling mentally shattered. The mechanism may involve effects on neurotransmitter systems involved in mood regulation and circadian rhythm control. These psychiatric complications often develop gradually, making it difficult for patients and healthcare providers to recognize the connection to amlodipine therapy. Some individuals undergo extensive psychiatric evaluations and receive inappropriate treatments when the actual culprit is their blood pressure medication. The combination of mood changes and sleep disruption can create a downward spiral that devastates quality of life. Yet, this connection is rarely considered during routine medical care.
Next, side effect number 11, hypotension and circulation problems. Ironically, your blood pressure medication may be creating dangerous circulation problems. Research documents cases of severe hypotension that can lead to fainting episodes, falls, and serious injuries. These episodes involve sudden, dramatic drops in blood pressure that leave patients dizzy, weak, and at risk for dangerous falls. Emergency department visits for fall-related injuries in elderly patients taking amlodipine are more common than most people realize. The challenge lies in finding the balance between adequate blood pressure control and avoiding dangerous hypotension. Some patients develop orthostatic hypotension so severe they cannot safely stand up, while others experience unpredictable blood pressure drops that occur without warning. Recent research has identified elderly patients as particularly vulnerable to these circulation complications, with some developing such severe symptoms that safe, effective dosing becomes nearly impossible to achieve. Next, side effect number 12, pulmonary edema and respiratory issues. The most alarming discovery involves amlodipine's potential effects on lung function. Case reports document instances of pulmonary edema, dangerous fluid accumulation in the lungs that can become life-threatening. Recent pharmacovigilance data has identified respiratory complications, including difficulty breathing and pulmonary edema, as serious adverse events. These effects are particularly dangerous in patients with existing heart conditions, where amlodipine can paradoxically worsen heart failure and lead to emergency situations. The mechanism involves complex effects on cardiovascular function that can sometimes impair rather than improve heart performance in susceptible individuals. This can cause fluid backup into the lungs, creating respiratory distress requiring immediate medical intervention. What makes this particularly concerning is that pulmonary complications can develop gradually, with patients initially experiencing mild shortness of breath that progressively worsens until they're in significant respiratory distress. The evidence is overwhelming. Amlodipine carries risks that extend far beyond what most patients understand when they accept that prescription. These aren't theoretical concerns, they're documented complications affecting real people taking this widely prescribed medication.
The research reveals striking patterns that challenge current prescribing practices. Women face significantly higher risks for several major complications, yet current dosing recommendations rarely account for these gender differences. The dose-dependent nature of many side effects suggests that millions of patients may be taking unnecessarily high doses that dramatically increase their risk of serious complications. Most importantly, many of these effects can persist for weeks or months after stopping amlodipine, and some may cause lasting changes that don't fully resolve. This challenges the common assumption that drug side effects are always quickly reversible once medication is discontinued. Genetic factors play an increasingly recognized role in determining individuals' susceptibility to amlodipine side effects. However, genetic testing prior to amlodipine initiation remains uncommon in clinical practice, representing a missed opportunity for personalized medicine approaches. Environmental factors also play crucial roles. Patients living in warm climates show higher rates of peripheral edema and flushing, suggesting that climate should be considered when selecting antihypertensive therapy. Age-related changes make elderly patients particularly vulnerable to multiple amlodipine side effects simultaneously. If this video was helpful, kindly type yes in the comment. That motivates us to produce more content like this. Please hit that like button if this information opened your eyes to the hidden risks of amlodipine. Share this video with anyone you know taking this medication. They deserve to know these facts. Don't forget to subscribe for more evidence-based content about the medications millions take daily. Thank you for watching, and remember, knowledge is power when it comes to your health.